All right. Uh, thank you all for taking time out of your day to join us here at the University of Chicago Harris School of Public Policy for this masterclass. I'm Blake Edwards. I'm the Senior Associate Director of Marketing and Communications for the admissions team, and I'm joined by my colleagues Devin River-Dramer and Sam Johnson. I am pleased to introduce our presenter, Assistant Instructional Professor Navin Kumar, who is an applied microeconomist whose research focuses on development, crime, and mechanism design. He earned his PhD from Boston College and holds master's degrees in economics from both Boston College and the Delhi School of Economics. I'm I'm really excited that Professor Kumar is presenting this masterclass because the topic, asymmetric information, is a foundational concept that Professor Kumar teaches in the course Principles of Microeconomics for Public Policy 2, which is part of the core curriculum sequence here at Harris Public Policy. And just for a little context, the courses in the core curriculum, which consist of economics, microeconomics, and analytical politics, are designed to help students build a mindset and the skills to be able to lead with evidence, reason, and strategic insight. And through the core, you learn not only how to think about problems, but how to ask the right questions, which is exactly what we believe policymaking should be about. And again, just to repeat before I turn this masterclass over to Professor Kumar, we'll be recording the session and will be available to attendees in the next few days. And if you have questions for Professor Kumar as we go through the masterclass, please type them in the chat and I will try to bubble them up in an appropriate amount of time so that it is pertinent to the topic that he is presenting at hand. And with that, I will turn it over to you, Professor Kumar.
Thank you, Blake. Hi, hello, everyone. Welcome. Uh, my name is Navin Kumar, and I teach the microeconomics and public policy sequence. So this sequence, which is like two courses that you have to attend and learn in, has a couple of different goals. One is to just give you a nuts and bolts idea of everything you need to know about economics. If you've taken an economics course, this is stuff that is an important part of the canon and you need to know it and leave with it. So these are your foundational questions. What determines the price of salt? What determines how much salt is produced? That's one of the goals, the duller one. The more directly relevant one is to explain, given market forces, given people just behaving as they normally would, what are the interventions? What are the kind of public policy interventions that are actually beneficial? And the short answer is your best kind of public policy fixes market failures, fixes situations that arise when people left to their own devices don't do what is optimal. And so today we're going to talk a little bit about that. I'm going to give you an idea of what a market failure looks like. Basically, it's when too little of a good thing is produced or too much of a bad thing is produced. Today we'll be focusing on too little of a good thing. And just so that you have some idea of what we're going to do, we're going to talk about asymmetric information and adverse selection. Asymmetric information is when one side of the market has information that the other side does not. So there's a person who's buying a car and a person who's selling a car. The person who's selling their car knows exactly how good their car is. The person who's buying the car or the apartment or the trading card or whatever it is does not know how good this good is. And so the issues arise when there's so much asymmetric information, when there's so little information available to the buyer that they decide, you know what, I'm just not going to engage in this transaction. And as a result, a whole bunch of mutually beneficial transactions don't happen. And this is most pressing in the market for insurance. So the idea here is transactions happen that benefit both the buyer and the seller, but sometimes due to asymmetric information, those transactions don't actually happen. And we're going to talk about under what situations that arises and how to fix that. And this is most pressing in the situation of healthcare. So healthcare, big part of most people's lives. And we're going to talk about why government policy looks the way it does and why it is actually beneficial to provide healthcare in lieu of, say, just straight cash. So we're going to start with a famous thought experiment from econ. This is the market for lemons. It's a stylized description of a fictional market for used cars. And the idea here is you have two types of cars in this market. You've got lemons. These are low quality cars. And so they have a couple of 100,000 miles, or there's some part that's defective. The car doesn't have a lot of life left in it. And nonetheless, it's still a car, still gets you from point A to point B. And so sellers are willing to sell their cars for, say, hypothetically, $3,000. And buyers are willing to buy those cars, again, hypothetically, fictional market, thought experiment, for $4,000. And if this is just a setup, you can already see the beneficial transaction that happens, right? So if I say the price is going to be 3,500, well, sellers are happy, they get $500 extra. Buyers are happy, they get a $500 discount on what they were willing to pay. So that's the kind of welfare that arises in a well-functioning market when a good is being bought and sold. Then the other half of the market consists of peaches. These are high quality cars. Sellers are willing to part with their peaches for $7,000. Buyers are willing to pay $8,000. Same idea, say at $7,500, there's a mutually beneficial transaction that can happen. And so when the information is perfect, we've got this lovely situation where lemons get sold and peaches get good quality cars and bad quality cars are bought and sold. And this benefits everyone who's in the market. So that's the nice ideal situation. When does the market fail? Well, suppose that the information is imperfect, but in a very specific way. Suppose the information is imperfect such that your buyers don't know the quality of the car in front of them. Maybe it's a lemon, maybe it's a peach, I don't know. And the seller, meanwhile, knows exactly what kind of car they're selling. They know whether they're selling a good quality car or a bad quality car. And so in this situation, imagine you're the buyer. You're buying this car. Suppose half of the market is peaches, half of the market is lemons. It's a coin toss. With 50% chance, you'll get something that's worth $4,000 to you. And a 50% chance you get something that's worth $8,000 to you. And so you're willing to pay something halfway between those. So suppose you're willing to pay $6,000 to basically play this lottery, where half the time you get a lemon and half the time you get a peach. You're happy, that's what you're willing to pay. If the person in front of you who is selling you this car has a lemon, they're happy about this transaction. They value that lemon at $3,000. They're happy to sell it for $6,000. But if they own a very good quality car, they value that car at $7,000. You're offering a mere $6,000. They're not happy about it. They don't want that out. They don't want to sell their car for this low price. And so what happens is that people who own peaches just leave. They don't bother. They don't stay in the market. They exit. And now the market is just lemons. There are only lemons left in the market. And so the price will be somewhere between 3,000 and 4,000. And at this price, so imagine that there's like a big open car lot and it's full of people selling their lemons. It's full of buyers who walk in expecting to purchase a lemon and are willing to pay, say, 3,500. You walk in with your peach, you see the price of 3,500 and you think to yourself, no, thank you. And you leave. And so the market is 100% lemons and it stays 100% lemons. No peaches are bought and sold. And this is a tragedy. This is bad because there's all of these beneficial transactions that could happen. High quality cars that could have been bought and sold, but are not being bought and sold. And so this is what we mean by market failure. Goods, there's too few peaches being sold. And if I were to present this problem up front, I think a lot of people would say, well, yes, asymmetric information is really bad for buyers, obviously. But from this thought experiment, you can see how it could be bad for sellers as well, right? If you own a peach, well, the buyer isn't stupid. They know that there's some probability. You can't convince them that it's a peach. They know that about lemons. And so nobody is willing to pay you a fair price for your high quality car. And so that's a tragedy, not just for the buyers, but also for the sellers. So this disadvantage is a extra nasty, gnarly sword because it hurts everyone in that market. Well, except for the buyers, people who are selling lemons. And so this is the fundamental kind of problem, and we refer to it as adverse selection. What kind of person is willing to sell their car at $3,500, only the people who own lemons. People who own peaches, absolutely unwilling to part with their car at that price. And so lemons select into the market, peaches drop out, adverse selection. And the result is a market failure. So there is a missing market for peaches. There could have been a market for high quality cars. Unfortunately, that doesn't happen. And so the buying and selling of these peaches would have generated some amount of happiness, right? People at $7,500, people who own peaches would be happy to part with it. People who buy peaches are happy to have acquired a peach. But alas, the collapse of that market means there's a whole bunch of goods that aren't worth buying and selling. And so this is what we mean by market failure. There's too little of this good being provided. Um, pause. Apologies for speaking very quickly. Blake, are there any questions? Great.
Nothing's come up yet.
Great. So this is the situation. And I've been talking about a hypothetical market for cars. This kind of this kind of problem arises in a whole bunch of situations, any kind of situation where there's asymmetric information between the buyer and seller. For example, if you're selling your apartment or selling your house, well, you know whether or not there are termites in the basement. The seller doesn't know. If you're selling something as simple as a trading card, so a Pokemon card or a baseball card, right? You know if this is an actual high value first edition Pikachu or whatever. The person who's buying it doesn't know if it's a real card or if it's counterfeit. So they might not be willing to engage in a sale with you. So this kind of problem arises in lots and lots of markets. And private markets have some solutions to this. The most obvious one is for the sellers to develop a reputation for being the kind of person who sells peaches, or if they're selling lemons, they will be upfront that they are selling lemons. And so all the stories about used car salesmen, if you've seen any of the old ads about Honest Al's used car lot, the reason that they focus on honesty, the reason that they focus on reputational concerns is specifically so that people know, hey, if Al says this is a used car that is a peach, it is in fact a peach. So reputation is one way that we deal with this problem. Another is inspection. So once again, you're trying to solve the problem of information. The problem is that the buyer doesn't have information. Straightforward solution, give them that information. So if you're buying a house, one of the steps that you have to take is to hire an inspector who will walk in with a big clipboard and many pages and will look at the house from top to bottom and look at 120 different items and check if there are termites or electrical problems, et cetera, et cetera, et cetera. And will give you a detailed list of all the potential issues that could arise if you were to buy that house. You could, if you're buying a car, take it, drive it down to the mechanic, ask your favorite mechanic to give it a once over, see if there are any problems with it, and they'll let you know. So inspection by experts is one way to sort of equalize the amount of information between buyers and sellers. And of course, you have your guarantees and your warranties. If this car isn't good enough, you can return it. Almost every major US retailer has warranties and guarantees, and part of that is to reassure people, hey, when you buy from us, you're getting a high quality good. We don't expect a lot of people to be returning it. So these are private solutions. There are also public policy solutions. This is a public policy course. So let's talk about what are the ways that the government can step in and improve this market to prevent this kind of market failure. One is to have laws that ban fraud. So for example, the Truth in Mileage Act of 1986 is a known US law. And this law is meant to prevent odometer fraud. So one thing that you could used to do back with these very old cars is to reverse the odometer so that it looks like the car has only been driven for 5,000 miles instead of 50,000 miles. So that's one thing that they can do. Some states have lemon laws, and these lemon laws apply to also used cars. And so if you buy a car and some major malfunction happens in the first 30 days, hypothetically, you can demand a refund. The Federal Trade Commission in the United States requires every car that is sold to come with a buyer's guide. And this buyer's guide does not require that you offer a warranty. But if you don't offer a warranty, you have to say it on the guide. And so there's like a nice, plain format, easily understood format where all of the relevant information is revealed. You can look up the VIN number of the car, for example, and so on and so forth. So there are lots of these solutions that exist for adverse selection, both from the supplied by the private market and provided by the government. Just want to take a minute to sort of clarify some parts of this. We've been giving you like this example is very black and white, good cars, bad cars, but you can also think of these cars as being existing on a spectrum. And what happens is, what could potentially happen is there are, 10 tiers of cars, and you've got high quality cars on one end, low quality cars on the other, and the price is some average of those. And the price is fine, but not good enough for the top tier car. So the top tier car leaves, and then the price falls. And then the second tier of car leaves, the price falls again, and so on and so forth. And so this is what we call a death spiral from insurance, or we call it the market unraveling, as the highest quality cars, highest quality objects exit the market and leave only the lowest quality objects. And I will add, once again, this is a famous thought experiment in econ, but it turns out this is an thought experiment from the 1960s. And so it is actually not that big a problem in the car market anymore. We've gotten very good at producing high quality cars. It used to be that the day you drove a car out of a lot, that car would lose 40% of its value. Why? Because what kind of person is selling a 1-day-old car? A person who owns a lemon. And that is not as big of a problem anymore. And so that number, the extent to which your car is worth less as a result of it being just a day old, has shrunk to something like 10 or 20%. So we're not talking about cars in this lecture. That's not the big problem. The big problem is insurance. And so we're going to talk about how adverse selection applies to insurance. This is a big problem in insurance. If you've ever wondered why your insurance contract for something looks the way it does, we're going to try and explain a big part of that. But before I dive into this, does anyone have any questions on just this thought experiment that we've looked at?
And speak of, we just got two questions in, Professor Kumar. Larson asked, does this account for short-term or long-term aspects of the economy?
I'm not sure what that means. Oh, it's a long-term problem. It's not just a short-term problem. Once the market has sort of crashed in this manner, and you actually do observe this. For example, you have a lot of variance in insurance rates going from one state to another. And those are the result of this some states end up in an equilibrium where you have only, or in this case, maybe cars, where you have only low quality used cars, and some might have only high quality used cars. Not for used cars, but for insurance, it is definitely a persistent problem.
Okay, and then two more questions. Yukon asked, is this the same situation when bad money drives out good?
Yes, this is basically that problem in a nutshell. Yeah.
And then one more from David. Efficiency wages refers to employers paying higher than the market rate to retain skilled workers,
Ah,
increase productivity, or I can see you're already enjoying this question, Professor Kumar,
I love this
or ensure
question.
loyalty. Is this a case where asymmetric information about the price of something, the wage of labor, increases with asymmetric information rather than decreasing as the quality of the labor is unknown to the employer or buyer of labor?
Oh, that is a fascinating question. So I don't think adverse selection applies to that particular labor market. The labor market is rife with asymmetric information problems. One way that you can think about this is think about long-term unemployment, right? If the longer you're unemployed, the more of an adverse signal that is. So we talk about signaling and screening and contracts a lot, and so hopefully that will, and I'm promising you an answer in the winter of next year. But yes, there is huge asymmetric information problems in labor. I don't know that adverse selection quite describes it, but we will talk about that when the time comes. Um, My favorite example of this is think about the US government, for example, the US military offers compensation partially in the form of college credits, right? Like they will pay for your college degree if you serve for a certain period of time. That's an example of the military trying to do the opposite of adverse selection. They're trying to attract the kind of person who wants to go to college, which for some reason again, I don't know enough about military to weigh in on this, but they prefer that kind of person. And so this is the kind of reverse adverse selection where they're trying to attract the kind of person who wants to go to college. Any other questions?
One more. Pavlik asked, why is it that the private solutions don't allow for peaches sellers to simply set up their own market to unmix the lemons from peaches and solve the information problem? What addition does the public policy add in comparison to these private solutions?
Well, so imagine that you've set up a peach market. Someone pops in and says, hey, I've got a car. It's a peach. Let me in. How do you know? How do you know that the car is a peach? So you have to either, get an expert, et cetera, et cetera. The other thing over here is, so imagine a house has been inspected. Then for some reason, the buyer walks out. Then the next person comes in. And now that person has to hire an inspector, and so on and so forth. So there's a lot of duplication of effort when we talk about equalizing information. And so part of what this does is to avoid that kind of duplication of effort, those extra costs that come with extra effort. Thank you. These are great questions. Please keep them coming. Okay, so insurance. Why does insurance exist? Just a very quick summary. People don't like risks. They especially don't like risks that are in the form of sudden spike in expenses or a sudden fall in their income. People want tomorrow to be much the same as today. And so if a fire destroys your house, oops, that's a huge expense. You need to rebuild your house. You might spend tens of thousands of dollars. Or if a crash destroys your car, you might spend thousands of dollars in fixing it. A lot of life events that you just don't have control over, divorce, unemployment, disability, illness, all of these things can really hurt and make it so that you have to suddenly cut back on your consumption or as a result of lost income, as a result of huge spike in expenses. So people dislike this deeply. They want to not avoid this completely. It's impossible to avoid completely, but to smooth things out. And it would be very nice if people could pool in their risks. So for example, if you have 100 people who own houses, and suppose there's a 1% chance of a house being destroyed, that house is worth $100,000. So what these 100 people could do if they all know each other and they like each other and trust each other is to say every year, each of us is going to put $1,000 into a pool. One of us is going to get unlucky and that person's house is going to burn down and that person will get the pool. And so now instead of with some probability you lose your house and with some probability you lose nothing, you guarantee are only going to lose $1,000. And so that allows you to plan, that allows your consumption to be nicely smoothed out over time. That's delightful. So that's pooling your risks. And in low income countries or amongst people who don't have like a long insurance history, the way that usually works is through kin networks. You have a bad harvest, you borrow money from your cousin in order to continue to be able to buy groceries. Unfortunately, the problem with these informal networks is A, they tend to be small. You only have so many cousins and uncles and parents, siblings. B, people have liquidity constraints. If you're poor, odds are so is the rest of your family, so is the rest of your extended kin network. And also, the risks tend to be correlated. If I have a bad harvest, my cousin, one village over, probably also has a bad harvest. And so they can't lend me the money to tide me over. They need money to tide over. And so for this reason, these informal networks are suboptimal. In higher income countries with more state capacity, with better communications, with better records, and better financial systems, you have insurance companies. And insurance companies basically do this. So they collect $1,000 from hundreds of people, and anyone who loses their house gets a payout, gets the $100,000 payout. and they charge a fee for this, and that's enough to cover their operating expenses. And so that's the idea behind insurance, which is it's a way for people to pool their risks, to protect each other from big swings in their consumption, big swings in their income. And so you've got home insurance, auto insurance. These things actually kind of work pretty well because information is symmetric. Anyone can look at your house and have some sense of what are the odds that it's going to catch fire. I know, you know exactly what the odds are. So for a bunch of insurance markets, it's not a big problem. Life insurance, not necessarily a huge problem, but it still exists. So adverse selection still exists in these markets. Why? Because people know more about their potential risks than insurance companies. So consider a market, and I'm being a little abstract at the moment, but I'll come to a concrete example in a second. Consider a market that has both high risk and low risk individuals. Your low risk individual is going to cost an insurer about an average of $1,000. So this could be someone who's got a $100,000 house and a 1% probability of failure. And this person is willing to pay $1,200 for insurance. So if I know who the low risk individuals are, I could charge them, say, $1,100. I'll pay out an average of $1,000, and I'll pocket the extra 100. Mutually beneficial exchange. Same thing. Suppose that I know who the high risk individuals are, and these people have an average of, say, $2,000 in payouts. So they cost me $2,000 in payouts. They're willing to pay about $2,400. Once again, there's a mutually beneficial transaction that can happen. I can promise to insure them in exchange for their premium. Suppose, though, I don't know who is high risk and who's low risk, right? This is why kin networks work. Kin networks work because I have a lot of information about the person I'm insuring. In a more abstracted economy, a more distant economy, I might not know. And so suppose that high risk individuals are about half the population. Well, then on average, a person in this market is going to cost me $1,500 to insure. At $1,500, this high risk person is thrilled to accept this insurance, right? They're willing to pay $2,400, they have to pay $1,500. They're thrilled, they're in. Low risk individuals, not so much. So low risk individuals are willing to pay $1,200. They're being asked to pay $1,500, they opt out. And so imagine you don't know which kind of house, the probability of a fire. The only people who are willing to stay are the people who are whose houses are highly likely to catch fire. And so prices rise, low risk individuals so now the high risk individuals stay, low risk individuals leave. The prices are only for high risk individuals. And oops, I raised my own hand. I don't know how to lower that. I will bear through. So low risk individuals stay out. And we have a missing market for insurance for these low risk customers. Adverse selection, prices are high. At these high prices, only high risk individuals stay, low risk individuals leave. And so we've got a market failure. So my favorite example of this is think about divorce. Very, very expensive, right? You have to pay a bunch of lawyers and court fees, et cetera, et cetera. But also, after you get divorced, you now are running two households where you were previously with some incomes, where you were previously running one household. Huge increase in your expenses. It would be nice to buy insurance against being divorced. What kind of person wants to buy insurance against being divorced? The kind of person who's highly likely to get divorced in the near future, right? And so we have, once again, this market failure. And just think, have you ever seen an advertisement for divorce insurance? Even though it's this very, very nasty life outcome, you get insurance for all kinds of nasty life outcomes, including death. You don't get it for divorce. And so this is an example of what I was talking about, where high risk individuals will stay at these high prices, and that drives out low risk individuals. So the high risk individuals are sort of the lemons of this. And it feels a little awkward to call them that, but that is the metaphor. And so you end up with a market failure, a missing market. And there are lots of these missing markets. You don't notice them because they don't exist. But if you're a student, maybe, and you're not sure if college is for you, you would like some insurance against having to drop out, not available. If you're an actor or a politician, maybe you want insurance against the paparazzi catching, taking a very unflattering photo of you or a scandalous photo of you. Not available because who's going to buy that kind of insurance? The, people who are up to scandalous affairs. If you're an artist and you're in your 20s and you're thinking, okay, I want to devote a couple of years of my life to try and make my band big, then you're in your 30s and your band is not big, well, you've lost a huge amount of time. You would love to buy insurance against that. Not available. And so there's a lot of these markets that just don't exist. And it's sad, but it's not like the tragic failure that we're going to see in a couple of slides. But um, here's where public policy comes in. So consider, for example, the market for unemployment insurance, or consider unemployment, being fired from your job suddenly without enough notice. That's a massive loss in your income and a massive loss in your quality of life. And so you would love to have insurance for those like 3 months or 6 months or whatever amount of time you're going to be unemployed, how much ever time it requires you to find a new job. You would love to have insurance against that. You would have to have some income coming in at that time. Unfortunately, you know what the odds are that you're going to be fired far better than the insurer does. This is not the case with life insurance. With life insurance, your estimate of how long you're going to live and your insurer's idea of how long you're going to live probably very similar. Not so here. And so we have adverse selection, and there is no private market for unemployment insurance. And by every 10 years, like some 10, 20 years, some clever young entrepreneur will say, aha, but what if we offer unemployment insurance, but you have to wait a year before it kicks in? Doesn't work. Even with 1 year's advance, people have a much better idea of how likely they are to be unemployed than the insurer. And so that's a big problem. Unemployment hits lots of people, and it is painful in and of itself, of course, but it's also painful because for a couple of months before you get a new job, you have no income coming in. Maybe you have no savings. Maybe there aren't appropriate tools for savings in your country. So that's a huge problem. The solution? Have the market, have the government step in and just provide that unemployment insurance or unemployment benefits, as they're known in many countries. So what the government does is while you're working, it will collect taxes. And then when you become unemployed for a certain number of weeks or months, it will send you a check equal to, say, 80%, 70% of what you would have earned. And so already, by the way, this is not redistribution. Redistribution is fine. There's nothing wrong with redistribution. But they are collecting taxes to pay unemployment benefits. Because people cannot opt out, there's no adverse selection. The problem with this kind of unemployment insurance is people who are highly likely to be, or unlikely to be unemployed, don't buy it. Here, they don't have an option. And so there's no adverse selection. There's this market failure is solved and overall welfare rises. Okay, I'm going to take a beat and say, there's a big question, which is why give people stuff? Why not cash? So suppose unemployment insurance costs the government an average of $200 per person per month. Why not just give them $200 and let them decide if they want to buy unemployment insurance or not? Because if you did that, you would have adverse selection and this market would collapse. They would be unable to buy unemployment insurance. And so this is an example where this is better than just giving people cash. This is even better than cash because you're solving this market failure. All right, so I'm going to take a beat. We're going to talk about health insurance in a second. But before we get to that, any questions?
There's one comment that came in and a question that came in. I want to share the comments. I thought was pretty interesting. It was in response to Pavlik's comment about private solutions don't allow for peaches sellers to set up their own market. Laura mentioned the public versus private companies are mandated by the Sarbanes-Oxley Act, which is a U.S. federal regulation for those not in the U.S., to undergo an annual independent audit. This relates to the private solution of an independent expert seen on one of the first slides. The result of the audit thereby proves that they are a peach or lemon, and the share price will reflect stock market participants' evaluation of that new information. Mandated or not, it is the interest of strategic companies to provide disclosure to distinguish themselves from lemons. I thought that was an interesting point different up in the conversation. I don't know if you have anything to add to
Yeah,
that, but I thought that was a pretty. I liked it. I liked that observation.
yeah, yeah, absolutely. That is, yeah. This is we'll talk about this when we talk about signals, but yeah, that is absolutely an example of trying to fix the problem of asymmetric information by equalizing the amount of information that everyone has.
Okay, and then
Any other?
yeah, Nathan Hale had a question. Do severance packages and contracted career transition services function as a sort of unemployment insurance where the worker takes a lower wage for a payout at termination?
Ooh, I love that question. Partly the answer is yes. Partly the answer is this is an example of sharing of risk. Because if I'm an employer, like I have many, many employees. If one of them quits, big whoop. If I'm an employee, I have one job. And so losing that job is a huge risk for me. And so severance and severance in contracts provides a sort of a hedge against unemployment. And so I will take a lower, as you say, a lower wage in exchange for this severance, which is a de facto form of unemployment insurance. Thank you. Yeah,
And
absolutely.
a couple other questions have trickled in. Julian asked about what you think about the challenges of insurance today, saying one could argue that to some degree the model of insurance is broken due to perverse incentives, inspectors marking down or denying claims, or the risks that we thought of as low are increasing. Facing these issues, do you believe these are the reflection of the same issues you go over in the lecture, or are these entirely new issues that market and public policy has not yet resolved?
They are going to be half talked about by this lecture, half talked about by a lecture on moral hazard, which is a separate one, which you'll see in the winter. So once again, apologies for kicking that down the road. But yes, so a lot of the problems in insurance do arise due to this kind of informational problem, and the struggles with both like dealing with the informational problem and the you'll see it in a second. But the short answer is yes. I think a lot of that arises due to this.
In
Thank
this
you.
in this one, maybe playing off of what you're just addressing, you can ask about the issue of moral hazard. Maybe the person was a low risk person, but after they know their loss will be protected by the insurance, they become bolder, which increases their risk.
Yeah. Yep. So the difference between moral hazard and adverse selection is types versus behavior. This is about what kind of person is buying the insurance. Moral hazard is about how they behave once they have insurance. Two slightly distinct problems, but both of which result in the same thing, which is market failure, a missing market. Thank you.
Okay, and then I got three more that I want you to be able to continue here, but I like that folks are engaged. Lewis asks, though not welfare, how can we evaluate the government's role in insurance? Property in California, for example, where the cost of the taxpayer becomes a burdensome on the state budget.
Yeah, so California is an unusual case because I really want to answer this, but you know what? I'm going to kick it to the end. If we have time at the end, I'll hang back and I'll give you I'll try and talk about that, but I'm
I'll
going to
denote that in the chat to make
take
sure we
some
get
while.
back
Thank
to it.
you.
And then the
Uh,
last two if we can, or you want to keep moving?
I'm going to keep moving, but
Okay,
can
we'll
we
get to well
pause?
everybody else, Diego and Srishasha, I will make sure you get notated at the end. My apologies. I want to
Yeah.
keep on the mark here. Thank you.
Okay. So similar arguments about disability insurance. The reason that the US government, for example, provides unemployment insurance and disability insurance is once again, these are going to be difficult to exist in the absence of a mandate that everyone has to buy it. All right. So, one of the biggest shocks that people can face to their consumption and expenses is health shocks. Cancer treatment or heart treatment, even something as simple as a tuberculosis treatment, can cost thousands of dollars. And healthcare expenditure is about 1/8 of US domestic production. So it's huge. Every eighth dollar is goes to healthcare. And in the United States, this is mostly paid for through health insurance. And adverse selection is a gigantic problem because buyers know a lot more about their potential healthcare needs than their insurers. Classic example, if you and your spouse are planning to get pregnant, you know about the plan, your insurer does not know. And so when you're buying and you innocently ask, oh, does this cover maternal care or paternal care or etc., that matters. And the most vivid way that I've heard this being described is, oh, you broke your foot or you broke a bone, pause and buy insurance on the way to the hospital. So that's the kind of potential problem that could arise. Healthy people won't buy it. And when they're about to require healthcare, they will then and only then will they actually purchase that health insurance. As a result of which the premiums are really high. And because the premiums are really high, low risk individuals, people who aren't planning massive healthcare expenditures or who don't face an imminent heart attack, won't buy. So, what's the solution to this? In the United States, a big part of the solution is group insurance. So, you get insurance from your employer, you get insurance from your university. And because membership of these groups is not quite as contingent, you're not making the decision to get a job for the most part, there's no adverse selection. And so this explains about maybe like half of the US population is covered under this kind of group insurance. And so that is the big answer in the health insurance field. But what about people who are unemployed? What about people who are self-employed? Maybe I'm a plumber, I have my own business of one person. What if someone is not working? What if they're just taking time off? What if someone is retired, et cetera, et cetera? What if they're working, but they're working part-time, and so they're not eligible for insurance, and so on and so forth. These people have to buy individual insurance. And so all of those like horror stories that you've heard about insurance in the United States often arises in this market for individual insurance. So this one person has to decide to insure themselves and then to buy a policy. And this is here, once again, you have adverse selection as a potential problem. And so insurance companies use a lot of tactics to sort of avoid this problem. And those tactics were deeply unpleasant for the people who were at the receiving end. So for example, before the Affordable Care Act of 2010 in the United States, insurance companies would set a premium based on your age, based on your medical history. So if you have a history of asthma, you face a higher premium. If you have a history of diabetes, you might have a higher premium. If you are older and probably more in need of healthcare, you're going to face a higher premium. That's unpleasant. They will deny insurance to high risk people. So if they think that you're going to cost them a lot, they'll just say, we're not going to insure you. And they will say, no, we're not going to cover this condition that you have. Maybe you have cancer, you lose your job, you need to buy individual insurance. Oh no, you have cancer, but you had cancer at the point of time where you bought the insurance. We're not covering treatment for this. So these are pre-existing conditions. You may have heard of this. And so all of these are deeply, deeply unpleasant for the people who, through, maybe their own decisions, but also maybe through luck, were at the receiving end of huge spike in my expenses and my insurance company isn't paying for them. And so in the 1990s and the 2000s, a lot of US states started to experiment with ways to fix this problem. And so we'll just cover one such experiment. This is Washington State, 1993, the Health Services Act. And so this act gets passed and it imposes a bunch of restrictions on both insurance companies and on the residents of Washington. So one type of restriction is called guaranteed issue. So if you're an insurance company and you're selling individual insurance and someone applies, you cannot refuse to accept them. If they apply, if they want insurance and you're selling it, you have to sell it to them. So you can't reject someone for being high risk. Community rating. If you can only change your premium based on, you have to charge everyone the same price. And what that meant in Washington State specifically was it can only vary based on zip code and family size. Family size, larger families will have higher payouts. That's understandable. Zip codes, I think this is because rural healthcare is very different from urban healthcare. And so this will vary a lot by zip code. That's the idea over here. Importantly, just because someone is already sick, you can't charge them more. Just because someone is 60, you can't charge them more. And so everyone pays the same price. And you can't deny coverage for pre-existing conditions. So looking at all of these all sound like lovely such things for the people who are buying insurance. But alarm bells should be ringing. Hold on, won't this result in adverse selection? If I'm guaranteed to be able to get insurance whenever I want it at a low, low price, and my pre-existing conditions are guaranteed to be covered, then why would I ever buy insurance unless I'm sick or I'm on my way to the hospital? So that's why this law also had an individual mandate. If you are a resident of Washington, you must buy insurance. You can't opt out of it. This was very, very, very unpopular. And I actually looked up this law, and it turns out that the law didn't actually specify the penalty like what punishment, what kind of fines you would face. But even in the absence of that, this was a deeply unpopular part of this policy. And so it gets repealed. So in 1994, the individual mandate goes right out the window, and the results are exactly what you would expect. The market starts to unravel. When people are healthy, they cancel their insurance policies. When they fall sick, they buy insurance. As a result of which, an insurance pool consists largely of sick people. And so the premium is going to be much, much higher. The premium has to be roughly the average cost of these people, right? And so the premiums go way up. The higher the premiums go, the more people exit that pool. The healthy people start leaving the pool, price goes up, healthy people leave, price goes up, and so on and so forth until you only have high-risk people left in the pool. And so insurance companies start to exit this market. At the time that the law was passed, there were 19 companies offering individual insurance plans. By 1999, none of them were left in this market. So the market just completely disappeared. So when I talk about the market unraveling, when I talk about missing markets, when I talk about market failures, this is what I mean. There's just no goods to purchase. There are no peaches, in this case, not even lemons. And so in 2000, the law gets changed. And the condition is if you have a pre-existing condition, that's fine. It'll be covered 9 months from now. So you can't wait until you have a heart. Why does that go? You can't wait until you have a heart attack in order to buy insurance against having a heart attack. And so these are the sort of like plans that were tested in the 1990s in different states across the United States. And so in 2010, the federal government passes the Healthcare Act, or sorry, this is misspelled, Affordable Care Act of 2010. And that includes both your nice guaranteed issue and your community rating. So you must offer everyone insurance. It can only vary by age and location. Age also, there are limits. You can only charge your oldest person 3 times what you would charge your youngest person, and so on. And so obviously this sets things up for adverse selection, for these markets collapsing. How do they avoid that? Well, a couple of things. For example, a limited enrollment window. There's only a certain time of the year that you can buy insurance or switch insurance. And so if for those of you who are from the United States, if you've ever wondered why is it that I have to wait until December in order to switch my healthcare policy, this is why, to prevent people from waiting until they fall sick in order to buy this. They had subsidies for low-income households, so that was a big part of it, financed through various excise and income taxes. And quite importantly, they had an individual mandate. Everyone has to buy insurance. If you don't, you might, when you're filing your taxes, you might face fines or tax of, I think, like $200 or something akin to that. Very unpopular. People did not like the individual mandate. They loved everything else, but they did not like that individual mandate. So it gets repealed in 2017. So let's see what happened to the insurance rate. So initially, so this is before, even going back to 2001, it's roughly 16 to 18% of US adults are uninsured. Then to 2010, this law gets passed, and steadily the number of uninsured people falls and continues to fall. Then in 2016, you see the mandate got repealed. It was actually basically the tax was set to 0, so effectively repealed. And you see a slight spike in the unemployment, in the uninsurance rate. This, by the way, there's a change in how they measured it, so that's why there's a gap over here. But fortunately, it seems to have worked, right? Today, about 8% of US adults are uninsured, where previously it was something like 16%. So arguably, the Affordable Care Act, even with that mandate repealed, seems to have cut the uninsured rate by half. Possibly that was because all of these other policies were highly effective. Possibly it's because a window in which everyone had to buy insurance caused the price of insurance to fall to the point where everyone was still willing, even the peaches were willing to stay in the market at this low price. And so I'm told that insurance policies did in fact get much worse at this point of time in the on the government exchange where these policies are bought and sold. But overall, uninsurance rate seems to have fallen. And this also explains, by the way, two of the largest line items in the federal budget. So those are Medicare, which covers 20% of the US population and is 14% of the US budget, of the federal budget. And so Medicare is health insurance for retirees. Retirees not in university, not working for anyone. And so they don't have access to group insurance. And so Medicare's purpose is to step in and provide that kind of insurance to people who don't have access to it. Medicaid also exists in order to provide insurance to people who, because their budgets are so tight, might choose to forego insurance in order to buy groceries, for example. And so this is again almost a quarter of the US population, and 10% of federal spending is on Medicaid. And so combine these two together, you've got something almost half the US population and a quarter of the federal budget goes into healthcare. Why? I want you to think about this as not just a form of redistribution. This is not just um, food or clothing, right? This exists partly because these are markets that are very fragile, that might collapse if people are just allowed to do whatever they wished. And so the government steps in, and even if, and so once again, going back to that question of why not cash? Why are you giving them Medicaid? If Medicaid costs an average of $200 a month, why not just give that cash to these low-income households and let them choose? Because if you did that, the market would unravel, is the short answer. And so this is a situation where public policy plays a huge role, where providing an object, an item, insurance, is better, a commodity, is better than providing them with a cash equivalent of that. So that's adverse selection. That's a problem of adverse selection. That's a problem of asymmetric information. Markets can collapse as a result of this. And having the government step in and impose laws about, or providing the insurance themselves without giving people a way to opt out of it, is a way to prevent that, is a way to improve welfare, to make everyone better off, and is even better than giving them cash. So that's it. Thank you. Once again, questions, and I think we can take the questions that were previously being
Yeah,
asked.
I do actually. Thank you so much, Professor Kumar. I hope I really appreciated how tangible your examples were and how applicable what we're teaching in microeconomics to is to these issues. I want to bounce to two questions that were directly tied to this last section. Um, Radhian asked, "Is Medicare for all actually feasible?" Which is a big question, I'm aware. What is your take on that?
I think it's expensive. It would be a big part of the federal government's line budget. So the short answer is I'm not sure. And the reason I'm not sure is because it would require a big increase in taxes. And this is something that, you should ask your analytical politics instructors. But for one reason or another, US voters really hate taxes. They've just absolutely loathe them. And so I don't know if it is feasible. And part of the reason I don't know if it's there's other arguments as well, but I'm going to stick to the simplest, which is it would require a 10 percentage point, like an additional 10% of US GDP to be taxed in order to finance it. I think 10% is correct. And that would be very, very expensive. Like it's hard to do.
Um, Laura asked, in 1993, was this act popular with healthcare plans servicing Washington?
I don't think it was. That's such an interesting question. I don't know. Um, I don't know. I don't know if how the providers themselves felt about it. I'll look this up. Usually this is the point in the lecture I would say, I'll look this up and like post something on Canvas, but there's no Canvas group. So alas, I have to say, I don't know. Because it should be neutral, right? Like the reason that these insurance companies, or if anything, it should be positive. The reason that these insurance companies had these rules in place was to avoid adverse selection. The individual mandate helps to like fixes that problem, fixes the problem of adverse selection. And so they just have to adjust their prices accordingly to provide these markets. So my hunch is that it was in its original form probably pretty popular, but then once the individual mandate went out, probably not so much.
And then we
There
will
were
return to, yeah, we return to a
yes.
couple questions. Yukon's question about moral hazard. Maybe the
Mhm.
person was a low risk person, but after they know their loss will be protected by insurance, they become bolder, which increases their risk.
Yeah. And so in the case of health insurance, there's a little bit of an abuse of the terminology when health insurance researchers talk about moral hazard. So in the context of health insurance, moral hazard might refer to something as, might be something like you consume too much healthcare. You you go to lots and lots, a lot more doctors visits than you should. You take a lot more tests than you should. You're just not trying very hard to avoid these costs because those costs are covered by insurance. So that's how moral hazard is used in that situation. And for all of these, the reason that insurance policies have deductibles. And so think about this, right? Every good that you buy, like if you buy a bicycle, you're paying one price. But if you're buying insurance, you have to consider a couple of different prices. You have to consider the premium and the copay and the deductible and the out-of-pocket maximum. What's the deal with that? Like, why are these all of these different prices that I have to consider when I'm buying insurance? And the answer is those exist in order to encourage you to do take more care. So if you're buying bicycle insurance, insurance against your bicycle being stolen, your insurance company wants you to lock up your bicycle every single time. But if you don't lock your bicycle and all that happens is that the insurance company buys you a new bicycle, you have no incentive. And so the insurance company will not fully cover your bicycle. It'll cover 80%, say. The first $100 or so comes out of your pocket. And that's meant to encourage you to take more care. So we'll have an entire lecture on moral hazard, but in short, yes, you are that is a huge problem in insurance.
And actually, Nathan mentioned about the moral hazard, like building homes in flood zones and then USG underwriting flood insurance, right?
Yep. Yep. Yeah. So yes, that is an example of moral hazard. I think California provides an unusually stark example because they have price controls on insurance. And they have price controls on insurance because that's the law. Like there is voters voted for this, and the way that California's constitution works, the legislature can't override this except with a supermajority. And so you have price controls. Legislatures can't do anything about it for the most part. And so the prices were set very, very tight. And so lots of companies who were previously offering fire insurance, began canceling their policies. And then massive wildfires struck, and a bunch of people who were previously insured found themselves without insurance. And so that's an example of where like a price control might cause an exit from this market because the nature of insurance is that the price that you're charging has to cover at least the average cost that you expect to pay out. And if it can't do that, you leave. And so yes, that was an adverse selection. There was no asymmetric information there. That was just straight up troubles with price controls, which is an example of a policy that, we don't like because instead it doesn't solve a market failure and in fact causes the market to be warped in certain ways that are deeply undesirable. It's one of the first things one of the first policies that we'll talk about.
Sriharsha had a previous question about what if government public policy is as simple as mandating insurance for those type for people with those issues, and wouldn't that solve the adverse selection issue?
Yeah, so that is the idea behind like a lot of the individual mandate, which is forcing people to you can't opt out of this. So adverse selection, people select adversely into the pool. If they can't select into the pool, there's no adverse selection. And so the mandates have that effect and are deeply unpopular. And I think part of the reason that they're unpopular is because it's so unintuitive. Like I've just spent an hour explaining this to you, but if you haven't listened to someone explaining this to you for an hour, you might not be aware of the problem. And so a law whose goal is to whose mandate this kind of thing might strike you as just being deeply unfair.
Uh,
Again, ask your AP instructors. political instructors.
Uh, Julian had a question about one of your focuses being crime and public policy. How much of this framing of asymmetric information and problem selection is used in your understanding of crime?
Ah, oh, that's fascinating. I'm going to say very little. The problem with crime is not so much asymmetric information as just the absence of information. You don't know who done it. Um, Interesting. I don't think that, yeah, so adverse selection doesn't really apply to that, but there are other sort of fighting crime is what we would call a public good, this feeling of safety that you get when there are very few crimes happening in your neighborhood. Everyone enjoys that. But who's going to pay for it? And so, left to their own devices, people would not voluntarily pay for a police force, same as they wouldn't voluntarily pay for an army or they might pay a little bit, but they won't pay enough for an army or a police force. And so this is the problem of public goods provision, and we're going to talk about that in micro 2.
Because I do want to be respectful of everybody's time here, and thank you, you all. Thank you for sticking around, President Kumar. Thank you, everybody, for sticking around. I want to get to the last couple questions if we have time. And again, feel free to drop off if you have other obligations. This will be available. We will get it saved to you, so you'll be able to view it in hopefully in two days plus. Um, a question from Wu Yang is the acceptance of certain policy related to the cultural or social issues? It seems like some European countries have high tax rate and public health care plans, but similar acts can't be accepted in the United States.
Yeah, so that's something I kind of cut for time. But the way that a lot of countries deal with this problem of healthcare is to just have publicly provisioned healthcare. And so, for example, in India, you have a mix of both state hospitals and private hospitals. State hospitals, you can get it for practically free. Private hospitals, you have to pay out of pocket. And so lower income households will use the state hospitals. Sometimes they don't function as well as they should. Yeah, so different countries have different approaches. European countries have sort of kind of a single payer system. So where you get taxed, and then those taxes are used to fund a healthcare system. There are issues with that are separate from the issues with the US healthcare. I won't there we have a health in you know we have a healthcare an entire healthcare course for people who are curious about why the system looks the way it does, who want more details on that. If the question is why can't we replicate that here, part of the answer is once again taxes. In Europe, there are much higher taxes. And I will say, partially defending the US system, the US system is actually a bit, at least, I don't know if that's still the case once this new bill passes, but it's actually pretty progressive because we don't have sales taxes at the federal level. We don't have VAT. And these taxes fall mainly on lower income households. And so the reason that European countries have relatively generous public facilities is that they have a higher rate of tax in the form of VAT, et cetera. And the US, the federal government is just not allowed to impose VAT, although they're trying apparently with the tariffs. So let's see how that goes.
And I'll get a couple more. Um, Actually, Alyssa had a comment building off this. Similarly, wouldn't a person's money just be redistributed from being spent on private insurance to taxes? How much of the problem here is a narrative being pushed by private insurance companies?
I don't know. I'm not sure. I genuinely am not sure. This is again like politics, not my domain. Um, my understanding is that the okay, so let me try and like not exactly play the devil's advocate, but try and explain why you don't see wholesale switches. Part of that is because a lot of American voters are quite content. Two things, right? One, American voters are surprisingly content with their insurance. They might not be happy with it. They don't like their claims being rejected. But for the most part, they seem more okay than public discourse would lead you to believe. The second thing, and this is, I think, the more pressing problem, is that the federal government the, doesn't have a lot of what we call state capacity compared to a lot of other countries. The number of bureaucrats we hire, their pay, the sort of like status in which that they are held is quite low. And so because the federal government doesn't have state capacity, they have to do a lot of like roundabout things. And so having the entire US in this giant 300 million, 340 million people country being run by the federal government would be difficult unless we invest a lot more in state capacity. Again, I'm not saying that you're wrong. I'm not. Uh, and I'm not quite playing devil's advocate. I'm just providing some arguments I've heard against the idea that, well, all we need to do is just switch from one to the other. But yes, you are correct in that you would just have higher taxes and but you would be spending less on insurance.
And then final question, my colleague Sam kindly put this in the chat. Our final deadline is for applying to Harris. So you can experience this over the course of many more weeks is June 12th. So that link, my colleague Sam dropped that in the chat. And then I want to give this last question for you, Professor, from Nathan. How would you assess government underwriting, not of individual health insurance, but of covering malpractice insurance for providers as a means of lowering costs and providing a benefit to the public?
Oh, that's fascinating. So I'll say partially, I think a lot of states do have rules that require you to buy malpractice insurance. So there is, I think, a individual mandate, for the want of a better term, that each healthcare provider does have to have malpractice insurance in many states. And I think that does go some way to solving the problem of adverse selection so that it's not just the ones most expecting malpractice lawsuits that buy. And so I think it would be beneficial. I don't know that you need underwrite. I don't know that you need the government underwriting it. You could just have a mandate because these are for-profit uh, bodies that can afford to cover it. But yes, absolutely. And also you do find, by the way, so for example, for those of you who are familiar with like the history of agricultural subsidies in the United States, they've changed a lot since say the 70s or 80s. Because these days, what you find is a lot of agricultural subsidies are in fact insurance subsidies. So if you have a bad harvest, then so the government basically underwrites your insurance and offers you cheap insurance. And so if you have a bad harvest, you can claim money from the government. And so the purpose of that is not just to transfer money to farmers, but also to provide them with insurance that they otherwise would not have been able to purchase on the open market. And so, yeah, so yes, so there is a lot of underwriting. I'm not sure that that specific form of underwriting is required, but I will note that, like, yes, that kind of underwriting does exist in many, many markets. Thank you. Yeah,
With that, again, we've stayed
great
over
question.
for
Thank you.
10 minutes. I appreciate everybody's activity with these great questions, Professor Kumar. Thank you all for joining us for whatever time zone you might be joining us from for the evening here in Chicago. Thank you again, Professor Kumar, for this presentation. I think it's really fantastic that folks are able to see what happens essentially in one of our core courses. I think it's a fantastic opportunity for folks. Thank you all for joining us. And as I mentioned, this will be available you'll be able to download this. We'll get this into the system so that people can have access to it as we move forward. But with that, thank you again, Professor Kumar. Thank you everybody for attending. And we will see you, hopefully, many of you in the fall.
Thank you, Blake,
Take
for
care,
organizing
everybody.
this.
All right.
See ya.
Take care, everybody.
Thank you all.